Hello, Abbotswood. Thank you for joining me for this month's Health Talk. This month we are going to be talking about falls prevention. In September, they actually have a Falls Prevention Awareness Week, which is next week, so this fits in perfectly with what's going on. We're not only going to talk about falls today and prevalence of falls, but we're also going to really focus on ways that we can prevent falls in our normal daily lives. If you guys don't know who I am, my name is Mike. I'm the rehab director at Legacy at Abbotswood here, and I am also one of the physical therapists. So if you guys have any questions about physical therapy, occupational therapy, or speech therapy, please let me know. I'm always running around, so just flag me down whenever you have a question. But like we said today, we're really focusing on falls prevention and falls prevention awareness. So we'll get right into it. And the first thing we're going to do is get an idea of how many people fall each year. I've got the results from a study that's been running since 1958. And part of the study looked at 3 different age groups and how often those people fall. And these are all community dwelling adults, okay? The study asked participants how many times they had fallen in the previous 2-year period. For each age group, I'm going to give you some choices, okay? What I'd like you to do is guess or just kind of guess out loud or in your head what percentage of adults in that age group reported falling at least once in that 2-year period. The first group is called the young group. People between the ages 20 and 45. And so what percentage of that group do you think reported having at least one fall in the last couple of years? Do you think it was 3%, 8%, or 18%? Again, I know we're not together, but go ahead and shout that out at the screen, whatever you think. And so it's actually pretty surprising to me that it is 18% of that young group reported having a fall. Then we jump up to what they call the middle age group, which is 46 to 65. And so again, the percentage for 46 to 65 went up to 21% of people that reported a fall. And then they said the older group, and I didn't make these labels, but the older group is older than 65, and so again, I think we are going to see an increase as we get older. That's kind of the purpose of what we're talking about. And they saw actually 35% of people older than 65 reported falling at least once in the past 2-year period. That number is consistent with other research, including figures from the CDC, which indicate that about 1/3 of community dwelling adults age 65 and older will fall, okay? So now that we've talked about the prevalence, we know that it is an issue. Obviously, living here at Abbotswood, we've seen that very often, that people are having trips and slips and falls. We're having to call EMS to help get them up. Obviously, every time we fall, we're at risk of something very bad happening. You know, we can break bones, we can hit our head. So again, we want to make sure we do everything we can to avoid that instance of falling. So now that we've talked about the prevalence, let's talk a little bit about what happens when someone falls. There are obvious physical injuries that can result in a fall, but there are other consequences. Okay, let's start with some of the injuries that can happen, and I just mentioned a couple. Obviously, we can break bones, we can have fractures, cuts, bruises, soft tissue injuries, head injuries, and even that can lead to death, because a head injury can be very severe, and that could cause us some very severe medical issues that could lead to death. So again, not to scare you, but just to understand the severity of what could happen when somebody does fall. Some other things, some kind of secondary issues that may happen. Obviously, if you fall and let's say you fractured your hip, the person is going to have to go have some sort of surgery. They may have to have a hip replacement. They may have to put a rod in the hip, just depending on what type of break it is. That creates a whole nother list of potential problems because of complications related to surgery. Okay. Physical injuries or deficits related to the fall are generally the easiest to spot, but there are other consequences that are not so easy. And so some of those, again, kind of secondary issues that we may see after a fall, again, not the actual breaks or cuts or bruises or injuries. Obviously, if you have to have surgery, you may be in the hospital for a little while. You may not be as mobile, so that could lead to functional declines. This could lead to restricted activity, obviously pain, loss of confidence, fear of falling, social isolation. Again, all this can start to lead to depression, feelings of helplessness, and decreased quality of life. Okay, so those are kind of secondary effects, of a fall, not just the actual bumps and bruises that we can get. Now we'll talk a little bit more about risk factors, and then we'll go into some interventions that can help alleviate those risk factors. So far we've covered the prevalence of falls in older community-dwelling adults, and we've talked about the consequences of those falls, not only the primary consequences, but the secondary consequences. Now let's focus on why falls happen, and then exactly what we can do about those. What we found out earlier, that among community-dwelling adults at least 65 years of age, the incidence of falls is about 35%. Some studies have found that an even higher rate of about 40%. As one ages, that rate seems to go up, and I think there's a lot of reasons for that. But what these studies don't tell us is the causes of those falls. So yes, they're telling us that it does get worse as we get older, but what exactly is the reason for those falls? Why do the falls happen? And so again, just thinking about, things that have happened to you, things that have happened to your friends, what they kind of say when they have those instances of falling. Slipping, tripping over a loose rug or objects on the floor, slipping on a slippery surface. Weakness obviously could lead to a fall. Weakness could also lead to just more unsteadiness on your feet, and that's going to affect your balance. Again, that can also lead to one of those falls. So let's talk about what puts a person at a higher risk of falling. Okay, we'll cover the major risk factors related to physical status, but first let's talk about the role that medications can play in falls. There's not a whole lot we can do when it comes to medications. We have to take those medications for certain reasons, but there is a very strong relationship between falls and the medications we're taking. Individuals who take more than 4 medications, regardless of what those medications are at increased risk of falls. Side effects of commonly prescribed medications can include dizziness, change in blood pressure, changes in heart rhythm, clumsiness and water retention, and that's just to name a few. And obviously all of those things can lead to a fall. You may say, what does water retention have to do with it? Or taking a diuretic to actually make us go to the bathroom a little bit more. And that's exactly what it is. Water retention may lead to an increased need to urinate, and people who are unsteady on their feet, they may be more likely to fall because they are just making more trips to the bathroom. Some medications increase the risk of falling because of their type or intended purpose. For example, antidepressants or anti-anxiety medications, medications to regulate heart rhythms, and diuretics. Some common names for antidepressants and anti-anxiety medications include Ativan, Xanax, Prozac, Zoloft, those types of things. Common names for cardiac medications include Norpace, Lopressor, Digoxin. And again, these medications just have side effects that can increase dizziness, can increase fatigue, so they can generally lead to issues when it comes to falling and steadiness on your feet. So that's kind of why we talked about those. So the American Geriatric Society's panel on fall prevention examined numerous studies on falls and ranked the most commonly cited risk factors for falls. They came up with a top 4, okay, but they came up kind of with 7 in general. But we'll talk about the top 4 that they've identified first. Number 1 on the list was muscle weakness. Okay, people with muscle weakness are almost 4.5 times more likely to fall than somebody that's a little bit stronger. So muscle weakness right off the top. Okay, obviously I'm a physical therapist. I work with occupational therapists. One of the main things we focus on in the geriatric population and in the population in general is trying to increase muscle strength. So that's one thing that we could address. History of falling. That actually people who have fallen at least once in the previous 6 months are 3 times more likely to fall in the next year than people who have not fallen. So that is a big factor. If you've had a history of falling, you know you are at higher risk of falling. So let's do some things to try to reduce that risk. People with gait deficits, okay, and a gait deficit can be a lot of different things, but what they've identified is people who walk with a short stride, with their legs close together, or with other gait impairments are nearly 3 times more likely to fall than people with normal walking patterns. So all they're saying is they've noticed that people who've changed their gait pattern, their normal walking pattern, they have shorter strides, they're dragging their feet, those types of things. Those things increase your risk by 3 times again. And then again, if you do have some sort of balance deficit, people who exhibit difficulty maintaining their balance during walking, standing, or sitting activities are nearly 3 times more likely to fall than those who don't have balance problems. Okay, so those are the big 4: muscle weakness, history of falls, gait deficits or changes in your gait pattern, and balance deficits. Some of them are fairly obvious, some of them maybe not so much. But you know, we can look at that list and probably check off at least 2 that we're all feeling right now. And again, that increased our risk by 3 to 4 times. So again, those are things we really need to address when it comes to fall prevention. Like we said, those are the most serious risk factors, but unfortunately there's more. Almost as serious are these factors. And again, these are just things they've identified in studies. And so the remaining risk factors are use of an assisted device, okay? The risk of falling more than doubles for people who use a cane or a walker or another assisted device. Again, it's not because of the device when they're talking about this. What this usually means is a person that is using an assisted device probably does have those other 4 things we talked about. They probably have muscle weakness. They probably have a history of falls. Something has happened to their balance and their gait pattern that have made them seek, you know, extra assistance through that cane or that walker. And again, just having that again increases that risk. Visual impairment, again, a lot of people may not think about this one as much. Individuals with poor vision due to eye conditions such as macular degeneration, glaucoma, diabetic retinopathy, cataracts, or low visual acuity are more than twice as likely to fall than those without visual impairments. Vision is one of the systems that help us balance, okay? And we have 3 different systems that help us balance. So if one is impaired, we're taking away a third of those systems that help us balance. So again, huge one that maybe not a lot of people think about. Another risk factor that they are listing is arthritis, and that is because it decreases ability to complete daily self-care activities, and that can lead to depression. Okay. Another risk factor is cognitive impairments. Again, if we're not aware, if we don't have that kind of safety awareness, we don't know what we should be doing, what we shouldn't be doing, that can increase our risk of falls. And unfortunately, just being over the age of 80, folks over 80 years old are nearly twice as likely to fall as people under 80. Again, nothing we can do about that, but having that knowledge and saying, yes, I am in that age group, maybe I need to do something to decrease my risk of falls and make sure I don't have something like that happen. Again, those big 4 and altogether we've gone over 7 different risk factors. Again, some we can do stuff about, some we can't. But as you can see, there are many factors that contribute to the risk of falling. Most of them don't occur alone, as you might expect. When more than one risk factor is present, the odds of falling go up. One study found that among community-dwelling adults 65 and older, about 25% of those who fell had 0 or only 1 risk factor. 80% of those people who fell had 4 or more risk factors. So again, when you're going down that list and you're saying, okay, I have this, this, and this, just having 2 or 3 or 4 of those is going to greatly increase your risk of falls. So now let's talk about prevention and intervention. So we know why people are falling, we know the prevalence, so let's see what we can do about it. And that's kind of the main reason we wanted to have this talk in the first place. So the good news is if you have a lot of these risk factors and you have checked off a lot of those boxes, that doesn't mean you will fall. There are many ways to prevent falls, even if you have that high risk factor. And there are a variety of professions that we need to go out and talk to who can help us. Number 1, your primary care physician plays a vital role in helping you reduce the risk of falling. Asking him or her about your current health status and medications impact your fall risk. So asking about those medications that they're giving you and asking about side effects of those medications. If a lot of those medications have dizziness or weakness, whatever it may be, we can maybe look for other options. Again, moving from there, a pharmacist is an excellent source of information about the medications you take, and then seeking out alternatives if, again, something does seem to be affecting you in those ways. If you have vision problems, again, seeing your optometrist or ophthalmologist, and know any difficulties that you have with your daily activities, including navigating your surroundings, reading, cooking, watching TV, and driving. So again, getting that vision checked, being up to date with your prescription with your vision, because vision changes, doing everything you can do to take care of your eyes when it comes to glaucoma, macular degeneration. There are obviously treatments that we can be doing to make sure that doesn't continue to get worse and worse and continue to hinder us. And the last thing they say is a nutritionist can be of great help in providing information and suggestions regarding the best diet to help you live with or prevent conditions that contribute to falls. He or she is a great resource for good eating choices related to cholesterol, blood sugar, bone strength, vision, and general healthfulness. Again, all of those things can tie into our risk of falls and avoiding those risk of falls. Of course, at last but definitely not least is your rehab team here at Abbotswood, physical therapy, occupational therapy, and speech therapy work directly, to avoid these risk factors. Number one, they work on, again, things to prevent falls as much as we can, okay? We can evaluate your risk of falls. We have a lot of different standardized testing, which can say, we go through a list of different activities, and we'll put you in a category of your risk of falling. That's really good to find out kind of your baseline measures. That also gives us an idea of what we're going to work on during our treatments. Obviously here at Abbotswood, we do have a great wellness department. We've just started to open up some of the exercise programs. One of those exercise programs is a balance class on Tuesdays and Thursdays at 1:30. That is an amazing class to try to make it to. Again, I think we have to sign up for that at this point because we don't want too many people. We can't gather with more than 6 or 7 or whatever it is right now. So getting to those classes, making sure we're doing everything we can when it comes to medication, again, staying active, trying to stay social in these very difficult times where we have to kind of remain away from each other is really, really important. Reach out to me, reach out to any of the other therapists, reach out to the wellness department if you have any questions about any of these things. Obviously, if you feel like you're a person that is at higher risk, we would be happy to do one of those screens to kind of see where you are right now, and then see is there anything that we can work on to help out and to make sure that we don't have those falls. And like I said, thank you so much for joining me today. We will try to continue to do these health talks, hopefully in person at some point. But we'll continue recording for right now as long as we need to keep everybody safe. Make sure when we're out and about we are wearing those masks and we're using good mask etiquette and we're taking care of those masks. And everybody have a great day. Thank you.